In the late 18th century, the lexicographer Samuel Johnson watched as his legs and thighs bloated with an unstoppable tide of water. He was suffering from an affliction that packed historical hospital wards and killed everyone from impoverished laborers to at least 9 different popes. They called it dropsy. For the patients who contracted it, the experience was a slow-motion catastrophe. Fluid would accumulate in the extremities and the abdomen, eventually pressurizing the tissue and creeping into the lungs until the victims suffocated on their own internal floodwaters. The statistics were grim. Half of all dropsy patients died within 5 years of their first symptoms. Desperate physicians often resorted to aggressive bloodletting in an attempt to relieve the swelling, a practice that frequently weakened the patient and accelerated their death. Yet today, dropsy has been completely scrubbed from medical textbooks. If you walk into a modern hospital, you will find patients with the same symptoms, but you won't find a single one with that diagnosis. Dropsy didn't disappear because of a vaccine or a miracle cure. It vanished because doctors stopped viewing it as a standalone disease. Modern medicine identifies this swelling as edema. It acts as a visible external indicator for a deeper internal crisis that is hidden from the naked eye. To save the patient, the medical establishment had to move past the superficial water retention and begin investigating the specific internal organs responsible for maintaining the body's fluid balance. This reclassification forced doctors to hunt for root causes, turning their attention away from the skin and toward the failure of the heart, the liver, and the kidneys. In the 1820s, a physician named Richard Bright discovered that the urine of dropsical patients often contained high levels of protein. By correlating this chemical finding with autopsies, he successfully linked the external swelling to damaged kidneys. This built on earlier work by William Withering, who found that extracts from the foxglove plant could stimulate the heart and rapidly reduce swelling. It was the first indication that a failing heart was a primary driver of the condition. These discoveries mapped out the body as a system of pumps and filters. If the heart part slows down or the kidney filter clogs, the internal pressure rises and fluid begins to back up into the tissues. Effective treatment required physicians to map the flow of fluid and identify the specific mechanical failure point in the pump or the filters. When the heart pump weakens, blood pools in the veins, creating high hydrostatic pressure that pushes fluid through the membrane. Alternatively, failing organs lose vital proteins. These proteins act like biological sponges. Without them, fluid escapes easily. Because this fluid is heavy, gravity dictates the symptoms. It usually starts with puffy ankles in the evening, but can escalate into anasarca, a state of massive, generalized swelling across the entire body. This mechanical understanding turned the severity of the swelling into a direct visual gauge of how badly a patient's internal organs were failing. Modern treatment requires a 2-part strategy. Doctors must stabilize the failing organ while simultaneously executing an emergency drain of the excess fluid that is putting pressure on the heart and lungs. Diuretics like furosemide are the primary tools for this drainage. They work by hijacking the kidneys, forcing them to flush excess sodium and the water attached to it out through the urine. By mastering this chemical drainage system, doctors can physically reverse the internal drowning process that proved fatal for centuries. But the body has its own defenses. In severe cases, patients develop diuretic resistance, a clinical state where the body begins to ignore the medication. This happens because a failing heart reduces blood flow to the kidneys. The kidneys mistake this for a loss of total blood volume and aggressively hold on to sodium to save the patient, even if they are already swollen with liters of extra water. A 2024 review from Zeta 2 Memorial Hospital confirms that this resistance remains a significant hurdle. In their study of hundreds of heart failure patients, a higher representation of severe cases struggled to respond to standard diuretic therapy. The transition of dropsy from a mysterious curse to a recognized symptom gave modern medicine the specific biological cues needed to identify organ failure while it is still silent. It remains one of our most important early warning systems.